So I have 40 minutes to talk to you and to sort of share my experience in how I actually reflected and how the mindfulness training impacted my work as a psychotherapist. So I thought that the agenda for the next 40 minutes of my presentation is that I'm going to give a brief introduction into mindfulness, and particularly in mindful-based stress reduction. I might talk a little bit about my own training, what outcomes this training had, show a mini clinical research. I see some of you are doctors. I'm not a doctor. I have few masters, but I'm not an academic. And I thought that maybe at the end we could do some experiential part where I was thinking of doing the guided meditation right now for the last 15-20 minutes, and then we will have a close with the questions and the feedback. I'm aware that, in the UK it's at 9 o'clock in the morning, and maybe the timing is not the best for this experiential part. However, the topic is quite rich, so I'm really open for your suggestions, whether you would, or your choice, whether you would like to do a guided meditation, or maybe you would like to engage in a discussion a little bit more. So I don't know if we have a voting system here in order for people to make their choice. And as a psychotherapist, you will see that this is very similar. I'm not leading this presentation as a therapy sessions, but I do not censor the session when my clients come. So I ask them how they would like to use the session. So I can't ask you how would you like to use completely, but I would like to have your choice whether you would prefer to have a guided meditation and experience something that I did experience myself and that I'm now more interested, or you are already a mindful and reflective practitioner and you would like to talk about that, how you do mindfulness and how you apply mindfulness in your work. So please let me know what would you like doing. So I can tailor the length of this presentation. What do you think? Any feedback? No? Okay, I will see how I get on with the timing, and then we can, I don't know how interactive is this platform for people to sort of join in, but I would appreciate if the organizers help with this voting. Okay. So regardless of whether you want to do this mindfulness with me or not, I would be really pleased if you noticed right now how you feel. Actually notice all about yourself right now. Whether you are sleepy like me, when I did this slide I knew I will be sleepy at 9 o'clock. Whether you are excited, whether you are maybe anxious because you might be presenting later. Maybe you are absent and daydreaming, worried for some reason, confused, or there might be more than one thing. And sort of, this is a emotional wheel which I use with my clients, and you will see that in the middle we have some sort of a basic feelings, like being fearful, being angry, being sad, being happy, being surprised. This is one of the vehicle sort of the tools I use. And then later on, in an outer circle, there is a little bit, if I'm angry, I could be angry and let down, angry and bitter, angry and aggressive, frustrated, critical, angry and critical. So when people talk about anger, they usually think about aggressiveness, but there is a spectrum of emotions behind these main emotions. And the same with the happy. When I ask my clients, how are you? And they say, well, I'm happy. What does that mean? Well, happy. What's behind happy? Happy. But if you go to the yellow circle here, you will see that I could be playful, I could be content, I can feel accepted, powerful, peaceful, trusting, optimistic, even hopeful. So sort of make a little inquiry how you feel right now. So mindfulness is meditation practice that involves focusing on the present moment. And we are aware what's going on in a present moment, and we don't judge that existence in the present moment. And it is a self-awareness, and it is a sort of a practice. And the individuals who practice mindfulness often report reduced stress, improved focus, and generally a better sense of self and enhanced well-being. At its core, really, mindfulness is some sort of an observational technique where we observe sensory experiences, our thoughts and emotions without reacting to them. I've just asked you to sort of, with emotional will, to notice how you are. That's all what I'm asking you, or I was asking you to do. Why this is important in psychotherapy is a really good question, and I found that there are two main benefits. One, or first, it can promote clients' healing by being self-aware. Very often clients are not self-aware. They are drawn by feelings, or they're drawn by thoughts too much. Of course, when I say drawn, we all have to be drawn by emotions and thoughts, but when they're too much drawn or imprisoned by thoughts or feelings, even behavior, then it becomes a burden, and it's not sort of a healing. We can't heal in that moment. And a second is, this is about the client or patient. A second benefit is actually when the therapist is mindful, it can strengthen the relationship can be better, and the mindfulness can strengthen the empathic relationship between therapist and the patient. And I will explain a bit more later. And actually, when the therapist is present, then the client really, I like saying that, can sniff. My clients can really know if I may be thinking about something else, if something popped into my mind. So in me being present, mindfully present for what client is saying, and also being attuned to what's going on with the story and with the physical presence of the clients, that could foster a more supportive and effective therapeutic environment. So I think majority of you might be already aware of that, of why and how we are present. So what we have in our, as a concept, we have a present, and the present, by the time I say present, is already a past. So there is this continuance of time where the present becomes a past and the future present, and the future present is a future. So there is nothing wrong. This is what it is, and the body is always present. The body is always in the present. Body can't be in the past nor in the future. But now mind actually isn't. So what we do most of our time in terms of mind, from when we focus on the past, we very often remember, and when we focus about the future, we are actually planning. So our presence is mainly, big part of our presence is either remembering or planning, And we usually worry what we remember and we worry what we plan. Of course, not always, we don't worry. We can be excited about what we plan, or we can be content about certain things from the past, but that's not the majority of the time what we do in the Western world. So this is a lovely graph here, that actually when we have too much of the past and not presence, we feel guilt, regret, sadness, bitterness, not forgiveness. And I'm certainly sure, for certain reasons and without a judgment, you maybe know somebody who is too much in the past because it was maybe too painful in that moment. And at the same time, you might know somebody who is too much in the future and not in the present. Sometimes they're planning, they don't necessarily need to show any signs, but something like unease, anxiety, stress, worry, and all forms of fear are actually present in worrying about the future because there is an uncertainty. And what is really interesting, there is also sense of control, whether I will be able to control my future. So, because I knew there will be quite a few of you who are very well academically, and this is about psychiatry. I did a little bit of a research why the mindfulness is good, not just in therapy, but for the patients. And this is what I found, and probably majority of you know that much better than I do, so I won't be too cocky in telling you things that you might already know. But the mindful-based stress reduction actually show that there is it's a scientifically proven method, that they are structural and functional changes that the brain that happens to a brain when we do things mindfully. And this is particularly in the prefrontal cortex, and which involves attention, emotion, and memory. It's a very, very interesting that part of the brain becomes more active. On the other hand, and on this drawing, that's the red part, and on the other hand, there is a gland, the amygdala, and that is somewhere, in between the red and the yellow. And you will see here where on the lower drawing where the amygdala is. That is the brain center of fear. And when we do and we practice mindfulness, there is a research, scientific research, that amygdala actually shows decreased activity. So one could say that we are less fearful when we practice mindfulness, but that's a far-stretched, statement to say. But I could say that actually mindfulness, and in terms of a brain and our mind, improves emotional regulation. The point is not to be non-emotional, but to have actual emotional regulation, and improves the stress response, so we are not on an autopilot with our stress, and actually improves behavior changes linked to mindfulness. And this is a little sort of anecdotal how to explain why this amygdala exists and why it is here. It's sort of evolutionally our brain in our brain it has evolutionally function, and we could say that amygdala is the fear radar. So this is the nature gave us amygdala to actually assess if something is harmful to us, and that we can prepare ourselves, whether, in terms of animal world, whether there is any predators, whether there is any lions, and then we can run. But today we don't have lions, we don't have predators, but we have amygdala, and then the amygdala makes the sense of what is around us, what is fearful. So the more we feel fearful, for example, the better amygdala will work, and eventually, I'm not saying it's going to overtake your life, but it's going to be very good. So whatever happens, amygdala will show up. In terms of, it is about survival, and it's about detecting novelty for the survival. And amygdala usually asks two questions. Will this thing kill me, or I can eat it? Any new stimuli triggers attention, while familiar stimuli actually are dismissed and to conserve the energy. So it's a really fascinating feature of our brain. And amygdala urges to tell me something new and ignores what is known, in actually keep us alert to threats or opportunities. And again, are we regulated in these threats? What are the real threats? So, how are we doing so far? Could you just give me some thumbs up, or are you here? Is everything okay? So, one would say, why did I choose this CPD? Why did I choose this training? In thinking about this, I sort of rationalized two different reasons. One is personal reasons, and the second one are professional reasons. So I have a little bit of a back pain that comes and goes, and no doctors can find out what, apart from my posture, is sort of wrong. But I found that mindfulness really helped me manage my back pain and sort of deepen my connection in between body and mind. I could actually meditate on that pain and somehow dissolve it. It doesn't go away, but instead of fighting that pain, I have a relationship with that pain. And developing a mindfulness practice became an essential self-care for sustaining good counseling practice. I believe so, as a person. And the professional reason why I wanted to actually do this course, in one of my master courses, I choose a topic, use of self. And the use of self is really interesting. We all, apart from being professionals in our field, we do use ourselves, who we really are, whether we are a little bit more serious, a little bit more, thorough, maybe we are a little bit, humorous and funny. So we use ourselves, our layers of ourselves, and I wanted some sort of experiential learning beyond, theoretical workshops. And it's an interesting thing in therapy particularly, but in life generally, we don't have a lot of this experiential workshops. So I was really looking for that. I was not looking for a conference or a training. I was looking for something that I can experience more. And mindfulness and this sort of CPD or training offered a really practical experiential route. And I really liked it. And in the end, I loved it. And somehow it naturally, this training connects personal growth with professional counseling or psychotherapeutic skills. So that course, I'm not going here to advertise the course, but it's a usually 8-week course, and it is set by 8-week course. It included every week 2-hour sessions, so it required commitment over 8 weeks. And there was lots of self-practice, exactly what I wanted in terms of experiential framework. There was reading material and homework to record things. And I did it with Dr. Garrett. He leads the mindfulness in Cambridge. And sessions were structured in these 8 weeks, and those are the sort of themes or the topics each week. Posture and body scan, which is the easiest way to access mindfulness. Then the perception, breath and awareness. The 3rd week was the stretching the body and seeing where the edges of the and the stretches of the body are. Then the 4th one will exploring the stress, but particularly in terms of reactivities. Then discovering the stress responses and alternatives to that. Stressful communication, it's an interesting the whole day and the whole week about stressful communication. Then it was about how to take care in times of difficulty. And the 8th one and the sort of last one is accepting, allowing, and exploring the change. So this 8-week mindfulness course is set up by others. I think I will mention that in my presentation later. But it's a standard. It's called mindfulness based stress reduction course. So it focuses on stress particularly. And I know situations and organizations where everybody, it was mandatory for all employees, whether they are professors or whether they are CEOs or whether they are juniors or cleaners or supply, they all needed to sort of complete this course. So there is a value in this course, and there is not just value, but there is a need for this course internationally. Well, this course hasn't been designed particularly for counselors and therapists, and really for me, in that case, it has really wider ranges of learning outcomes. So I've just sort of drafted here a few outcomes. First and the most important for me was the personal development and self-care, which I mentioned. The second one is increasing the self-awareness in the session. And I just thought, not that I actually wanted that when I started training, but I wanted to sort of deliver the message of mindfulness and potentially teach mindfulness to clients, patients. So what I did, personal outcome, I learned to pause, relax, detach, restore, and balance. I thought originally that this mindfulness will be sort of a quick fix. So I will go on this training, 8 weeks. I know I will have the knowledge and I will do the change. But actually, the course itself and the practice proved me really wrong, that knowledge has nothing to do with that the mindfulness is being present, and it's a skill rather than a knowledge itself. It's good to have the knowledge to know why certain things are happening, but not actually, but it isn't enough. Really, daily mindful practice enhanced my clarity of thoughts a little bit and some emotional awareness. So at the moment, I'm perfectly relaxed. So I know that I am sort of more than half through to the slides. I'm not nervous. I'm just observing it's 9:58. So I'm fairly confident and relaxed and keen to share with you presentation. But if it is 5 minutes to the end of the presentation, I might be anxious. I might be actually talking quicker. So actually, this mindfulness made me curious and proactive about self-observation, which I just shared with you, and it did interrupt automatic unhelpful reactions to everyday stress. Not all the time, not every time, I must confess, but it did help. Interpersonal outcomes really are also that professional one are that when I'm in the room with the clients, I am really not acting on autopilot, whether my autopilot or they are actually projecting something on me and I'm taking that. So I'm actually more present, but also I am not hiding behind some theoretical approaches. So if I have a client and they present something, I hold this curious position. I don't immediately try to put through the theoretical machine to see what could be or could be. I do that as well, but I'm actually not relying. I'm more present. I sort of experienced that I have more clarity in terms of thoughts and emotions. Maybe I noticed some subtleties in myself and the clients, small things, and I became more open and curious during session. I did recognize quite a lot of transference and counter-transference dynamic between my clients and myself. And in terms of immediacy, definitely mindfulness improved in terms of immediacy. So I'm saying here, I'm sharing with you a few words like transference, counter-transference, and immediacy, but those are the therapeutic elements which help us in therapy. So some of you might know that, some would not. It did improve the self-reflexivity. I was really able to hold multiply perspectives simultaneously. So it's like a conductor, I think. That's what I actually noticed significantly. I was sort of really able. And my memory improved. I was really astonished one day that I really remember what the client says from previous sessions, not the last one, but let's say a month ago. Mindfulness is there is a claim that the mindfulness increases the empathy and compassion. In my case, I didn't really notice that I'm more empathic and compassionate, but it was a slightly enhanced sort of horizontal quality. If you just bear with me, I'm just going to have a glass of water. So, and if you remember present and the past, future slide, for the clients who are in distress, they are in distress because of the past, of the future. They're not necessarily distressed because of the present. Yes, they could be worried if they lost a job, but it's in terms of presence. I found that the mindfulness was actually able to bring them in a present, and when they're in a present, there is a reduced anxiety, fear, rumination, and reactivity. And I have one client who said after the session, where we started from the top picture and we sort of ended in a bottom picture, he said, it feels I'm not anymore in the mercy of my feelings as I was when we started. Mercy of my feelings is almost a powerless position. With couple therapy, clients are grounded, they communicate better, I found out that they don't blame each other that much, though they do. Some clients actually develop their own mindfulness practice, and they have anecdotal encounters at home. So I'm just aware of time. I'm here. You will have the slides. You will see the methods and materials I did. Clients, who I had 17 individual clients and 10 clients, 5 heterosexual couples. So it's a very small pool of people I worked with. But generally, there is, I would say that generally there is a tendency in sort of being better with mindfulness. Mindfulness in a therapy room, I would do the check-in like I did with you. How are you just now before we start the question? And I will do that at the end. How are you now after the session? It's important to see the difference. And also this is a little sort of with those who are really very distressed. And this is sometimes those who have panic attacks. This is a 4 seconds quadrant when they will inhale 4 seconds, hold 4 seconds, exhale for 4 seconds. Sorry, there is a mistake here in spelling. It should say exhale, and then hold 4 seconds. And by focusing on that, focusing on something else rather than their thoughts, the thoughts are able to let go the emotional charge. And the same technique is to mindfully name every object or artifacts in the room that starts with A, B, C, and that's actually move them from distress. In a couples therapy, again, they learn better not to interrupt each other. I work with psychosexual presentations as well. Mindful sex focused on sensations of touch, breath, and connection. It's not a performance. It's actually a deepening intimacy. It also creates desires and boundaries and of mutual respect. And for those who are actually breaking up in relationship, mindfulness helps the urge to contact the partner or to tell them something else that they haven't told them yet. For me, it actually helped reducing the burnout, so I'm a little bit more aware. And again, like I said, now I have a routine maintenance of that. It can be incorporated in other therapeutical framework. It comes as a counter-transference, projective identification, transference in psychodynamic, and it comes as a self-reflexivity in a systemic therapy. And we can use mindfully in psychotherapy education, particularly in supervision. So I know that I have just 3 minutes left, but I think it will be lovely if you can tell me how you improve mindfulness in your work, incorporate mindfulness in your work. Do you do mindfulness? So it'll be good to see you guys.
Hi, Slavitia. Hi, I'm Yurasha. Yes, I think for healing to take place, we have to be mindful, and it is an approach that if you're not present, then the healing is not going to be possible. And being aware of the thoughts and the feelings and all of that. So, I think I use mindfulness all the time in my therapy practice and even on myself. Thank you for sharing that.
Thank you. So, as you can see, what I can learn myself in terms of mindfulness, that I am over optimistic. I thought I can do even the experiential stuff with you, but I'm not. I'm learning this lesson again and again. So I will finish with so this is how I would really do guided meditation. I like meditation in because of the back pain, but generally lying down, I really appreciate and like that. There is people ask me usually on this, what's the difference in between mindfulness and meditation? And I think, meditation is the way how to be mindful. Mindfulness is state of being, and meditation is practice that cultivates that state. I know, and I have a task. I could be mindful in conversation. I focus just on conversation. If I'm chopping the carrots, I could be really mindful. I'm saying I could. It's a long, learning. But chopping carrots, I hear the sound. I see the orange color. I see the texture. I'm there with that carrot. So there are lots of different things how we can be mindful. And again, there was almost 40 minutes from the time I asked you how you were at the beginning. And if you can just notice now again, how are you right now? Has anything changed in your emotions, in your behavior? Is there maybe something in the body because we are in front of the screens for 40 minutes? And make a self-inquiry. So that's a constant, how am I right now? So, and at the end, I want to say that mindfulness supported me and my practice and the clients, and even brief mindfulness practice, it really have positive impact. And don't shed of actually brief mindfulness break. It doesn't need to be lying down for 40 minutes. It could be, few minutes, just like we did in this moment. And I just want to say thank you for listening to me. And I just wanted to quote for the end John Kabat-Zinn, who says that mindfulness is not a technique, but it's a way of being. Once, like Nisha said, once you come on that journey, you become more aware and it becomes part of you. So thank you. Thank you. Thank you all. Thank you for your time. Hi, Rosalie. Okay, yes, I can. How do I see the question that Rosalie has?
She hasn't written it down in the chat.
Okay.
Okay, she has.
Hi,
Her
good
question is,
afternoon.
can you please, yeah.
Am I
How do you
audible?
start mindfulness with clients who are new to it?
Who are new to it? It's exactly. So if you're a client, you know, and you come to my session, I will ask, let's do with you, Nishra. You're a new one. Are you new? Let's sort of, I will ask you. No, I will ask the lady, sorry, Tazeen, isn't it? Let's say Tazeen is the new one, comes and has problems, and you know, I will just ask her, tell me how you feel. Because very often clients want to say what has happened, want to tell me the story from the last week. So tell me how you feel right now. They might say, I don't know how I feel. And the moment they say, I feel, and they're trying to figure out how they feel, that's one thing. So focusing, or I might actually explain to them a little bit what the mindfulness is. What is the quality of mindfulness? I might also notice something that it's, you know, telling them, how do you feel about yourself these days? You know? So introducing that observer, look, if you and your husband, if I'm a fly in your house, what would I see in between you and your husband? What would I see? What sort of relationship? And then they say, oh, you will see that there is a teamwork. What else? You will see that there is a bickering. So they're actually saying what they, you know, it's an observer position. So they're not, the beauty is, and I explain to them in this work, the beauty is that we live our lives, we are actors, but also we can observe our lives. We can be observers. I'm now observing that I'm maybe giving you a long answer and then I need to stop. So I'm self-aware. Does this make sense? Okay. Thank you.